Thanks very much, and welcome everyone to the launch of the UHS Digital Strategy for 2021 through 2026. For those who don't know me, I'm David French, Chief Exec here at the Trust. And I suppose I'd open just a couple of thoughts. Back in May, we launched the corporate strategy, and there's two pillars of that really spring to mind when we're thinking about digital. The first is the section on innovation. You'll see on the slide there, the second one down, pioneering research and innovation. It's what we're known for. We are a really high quality university teaching hospital. We want to continue to be world class, and clearly digital has got a huge role to play in taking that innovation piece forward. The second one, in particular, foundations for the future. So this section of the corporate strategy describes how our corporate infrastructure, and by that I mean our estate, our finances, and our digital infrastructure, can support, again, a world-class leading university teaching hospital. And we've got really good form in this space in IT. I describe it as we've really punched above our weight. We've had the benefit of the GDE funding, which has moved us forward hugely. But I think now, as the GDE money is coming to the end of its time, we've got to work out how we continue to punch above our weight, continue to innovate, and carry forward that digital agenda. The corporate strategy was quite a high-level North Star direction of travel for UHS, and what Aid and the digital team have been doing is writing a strategy for how digital will contribute to the corporate strategy and get us to where we need it to be. So if you haven't had chance to read the UHS Digital Strategy, I urge you to read it. I urge you to get involved, get into the discussions, get into the engagement on it, because it's a really critical part of us delivering our corporate strategy for the next 5 years. So with that, welcome again to the webinar. Thanks for coming and giving up some of your lunchtime. And I think, Aid, I'm handing over now to you.
Yeah, thanks very much, Dave, and thanks for doing the introduction for us, and thanks everyone for joining today. As David said, we've had success over many years in digital, and I think it is somewhat of a paradox, actually, that digital and the implementation of IT systems and clinical IT systems, especially, it seems, takes such a long time, but it does. Even those who have the large, usually American, out-of-the-box electronic patient record systems, it has to be said, really, they take a long time to implement. And in fact, I was just on a call before doing this presentation with the CIO from Bradford and Calderdale. 5 years after implementing their system, they're still not in therapies and ologies. And some of the replies, Rotherham have been doing this for 10 years, they're not implemented fully yet. Sunderland, who just recently achieved HIMSS level 7, actually, which is the highest level of digital maturity measurement, but they've been doing this for 22 years. So my message is it takes a long time, and continuity is key to good value, I think, in delivering this service. And we have largely built on what we have. So that really, some luck, I guess, but also some good planning. We've made some good technology decisions. But now we do have some legacy to deal with, and obviously the environment is much bigger, so the technical debt does become a problem, undoubtedly. So, we're challenged in various ways. So I think David just outlined, really, the board knows that to deliver world-class care nowadays, really, you need world-class digital. So a lot of this is about building trust. And I think that our success so far has built trust, both internally in the trust and nationally, as David mentioned. We've been a part of the NHS England Global Digital Exemplar Programme. The strategy is ambitious. We still have an objective to achieve that high level of digital maturity. In fact, on that HIMSS scale, up above level 5, a completely digital hospital. And now, of course, we do have to work more within the ICS context, and you'll see that in the strategy if you read it. On the slide there, some of the things that we've done in the last period through the pandemic. The pandemic has seen the implementation of many advances. Undoubtedly, I think accelerated delivery in some areas, areas that we wouldn't have expected to be working in at that point. So more working at home, video conferencing, mobile in general, processes such as handover, MDTs, but even board meetings actually that are now done over technology. So we wouldn't have expected to be doing any of those things now. The downside, of course, is that has held up some of the things that we would have expected to have done, particularly around paperless on wards and our e-forms program. So there's been some swings and roundabouts in the last 18 months or so, for sure. So we definitely felt it was a time for our strategy to be refreshed. There are various drivers for doing this that are shown in the chart on that slide that I've got up on the screen at the moment. So I think as a part of building and maintaining trust, we believe we have shown that technology can make a positive difference and that rapid change is possible. This does mean that we'll be asking for a significant contribution from trust members of staff who are already, we recognise this, already under great pressure. And in the coming period, we want to introduce paperless on the wards, and we recognise that is going to be a big effort from people. But we're trying to make the things that we do build on what we have. We're trying to make them user friendly, and we're trying to make it ultimately of benefit for everyone, so it is worth their while to get involved. So it's a big ask, and we just ask that everyone bears with us and does indeed put that effort in, because we do think it'll be worth it in the end. So thank you, and as David said, please do go and have a look at the strategy. I think the link is going to be posted up in the chat. But I'm now handing over to Ashwin.
Ashwin, can you unmute yourself, please?
I've just realised that. Thank you. Thank you. So just to introduce myself, my name's Ashwin Pinto. For those who don't know me, I'm a neurology doctor, and I'm the joint CCIO with Mike Solinsky. So just to take on those themes that Aid has brought up, we're going to talk a little bit about outpatients, and particularly about how this the digital strategy will change the experience for both patients and for doctors. So we'll start with doctors first and then move back to patients. So in terms of doctors, we recognise that actually the information required for you to manage your patients isn't always easily available. I can see that I'm joined today by a colleague from Portsmouth who I know we have specific challenges with the way that doctors who work across sites have to access and process information, and that has got to improve. And in this sense, the ICS is both a challenge. It's a challenge because it's changing the structure of pathways and so forth, but also an opportunity to join together things that previously weren't very well linked up. And so I'm confident that when we work with our colleagues in other hospitals, we'll be able to join up pathways in the way that we haven't been able to do as well before. We build on good structures. We've got, for those who know the systems, we've got a system called CHI that builds on something called Hampshire Health Record, and that was one of the first examples of a shared record across primary and secondary care anywhere in the NHS. So we start from a good base, but we've got a lot of work to do. The second and key aspect, I suspect, of the way that we will be able to keep patients at the centre of pathways and improve efficiency and experience for patients is My Medical Record. So My Medical Record is for those again who don't know, that's a shared personal health record with the patient. We've done an awful lot of work. The My Medical Record team have done an immense amount of work over the last few years in delivering something that is now a product that we can widely make available to patients at this hospital. And for those who don't know the numbers, we've just hit 100,000 with plans to scale much further than that. So we think that My Medical Record with the patient at the centre of those pathways will be key to achieving success. And then finally, this opportunity for new technology to change how we manage patients. And there are, I think, two really good examples that have come out from this. One from cardiology, which I thought I'd share with you, and one from my own specialty, neurology. So we start with cardiology, just the most remarkable bit of technology. So now you can implant into a patient with severe heart failure, which is, for those who don't know, a very life-limiting condition. We've got an outstanding team of heart failure specialists at the hospital, and they implement a device. They can insert a device, an invasive device, that can be then monitored from home, which allows really unbelievable precision in titrating the patient's medication against their symptoms, something I would never have dreamt we could have done in the past. So that sort of technology is coming very quickly. In my own specialty, in neurology, we used to have incredibly long waiting times to come into hospital to video record patients who are having epileptic seizures. Now, in selected cases, we can do that at home, and that's brought wait times down to weeks, not literally months from before. So we can see that technology is going to change patients' experience, is going to improve pathways and allow patients to achieve much better symptom control, or in some cases curative treatment, much quicker than they could previously do, because we'll join together various parts of the pathway that may start and end outside of our hospital, and we'll be able to monitor patients better, and we'll be able to share all of that through a medical record that the patients can access from wherever they have an internet connection. So that concludes my bit. I'm going to hand over now to Mike Solinsky.
Afternoon, everyone. I'm Mike Solinsky. I'm joint CCIO with Ashwin, and I'm also an intensive care consultant and anaesthetist. The digital strategy has 5 programs of work. There's digital patients, digital at point of care, supporting team working, information insight, and increased trust productivity. And I would like to give 2 examples how we plan to transform the care of inpatients using the digital strategy that encompasses all 5 programs. So traditionally, communication within hospital has been through landlines and bleeps. And this is a very inefficient and distracting way of communicating. If you can imagine, you've got to bleep someone, you've got to know their bleep number, you've got to find a telephone to bleep them, and then you've got to wait 5 minutes, sometimes longer, for that person to reply. If you're being bleeped, you might be very busy, you might be examining patients, and you don't know the urgency of that bleep, so you have to leave whatever you're doing, find the telephone, and answer that bleep. So clearly on both sides of that communication, there's a lot of time wasted. So one way we will hope to improve on this is by introducing electronic messaging. Thereby, staff can be communicated to by personal devices, iPads, PCs, without being distracted. We hope to also encompass in that messaging a task-based solution to help manage all those messages. Just about every bleep in the hospital is a patient-related task, often a member of staff asking another member of staff to do something with regards to a patient. And that list gets longer and longer with more and more jobs to do, with more and more workload that staff have. So we hope to help them by using a task management solution, not only to manage their own list of tasks, but also to help to prioritize those tasks so that urgency can be delivered where it is needed, but also to delegate those tasks to other people within their team. So to try and bring back good team working to help manage patient care. Another example is notes. Traditionally, notes have always been on paper, sometimes many volumes of notes in the old times. Now we've managed to get rid of the old volumes by scanning old patient records so that those are now available to anyone at any time. But we also hope to do that now to all inpatient notes, whereby all inpatient notes will be electronic from the start. So no more scanning. Now, this is a great benefit because not all notes are legible. And also notes often go missing, even on a ward. Sometimes trying to find a set of notes can be a challenge. So we will have the opportunity to write notes anywhere within the hospital, potentially even outside the hospital, if you're involved in a telephone conversation with giving advice on patient care. So this will allow staff to help to make it easier for them to document tasks or messages, or notes on patients. The other great benefit is that we can also use clinical decision support. So if a diabetic patient comes in, we know immediately from the digital notes that this patient has got diabetes, and appropriate pathways and appropriate teams can be notified straight away. So with both those two innovations, we hope to really improve patient care, but also improve patient safety and the efficiency of our staff. Thank you. I now pass on to Sarah, I believe. Or
Hi,
Gail.
Mike. We're actually
It's-
handing over to Gail.
Thank you. So yes, excuse me, I've got a little bit of a cough, but I've got a negative lateral flow, so don't worry, everyone. Yes, it's my pleasure to be part of the launch of this digital strategy on behalf of Sarah, who unfortunately can't be with us today because she's just recently suffered a family bereavement. But I have been out and about with Sarah on the wards, and it's great going out and looking at what we've been doing in terms of digital for nurses. So I guess, what does it mean for nurses and healthcare assistants? Well, definitely all patient information becoming electronic is something that actually way back when, and actually 30 years ago, when I was a resource management project nurse and looking at a nursing information system, this is something that I would have wanted all that time ago. We will make sure that it's delivered in a user-friendly way, and it has to be intuitive, and it has to work for nurses. So in terms of automation and escalation, I think a really important bit is the escalation of observations, for example, with news when the score goes up. So enabling nurses to enact on those observations. The other thing about an integrated experience, we have an example of that would be having a single sign-in, so that people can access all the information in one place, and that just makes life much easier for us as nurses. Next slide, please. So what does this mean for therapists and midwives? Well, very similarly, actually. So next slide. I think, so for me, I don't think the slide has gone on, actually.
Can you see the therapist and midwife slide?
I can see the
Yes.
what it is. Oh,
Yeah.
can you? I can't.
Okay.
Sorry. Anyway, so not having paper will mean that we'll be able to access data about the integrated patient record at the point of delivery of care, rather than something that's done retrospectively. So great kind of innovation. We'll be able to know about actually how we collect our statistics that will benefit our business intelligence strategy, which will help actually produce insightful information. And you'll be able to have dashboards around the care that we are providing. In lockdown, the issue on my medical record enabled our AHPs to work through consultations, through video consultations. And that's something that we need to strengthen going forward, because there are certainly lots of things. So, for example, for the dietitians who are able to work collaboratively with their patients to produce food diaries and monitor their nutrition online. So that's something I think AHPs and specialist nurses will really be able to benefit from. And for midwives, well, we've successfully recently launched Badgernet, and actually that is in terms of the record of care, and I think that we'll really benefit from that going forward, and was really embraced. I was very pleased to go over there when we launched Badgernet, and they were giving out tiny little furry badges, not real ones, by the way. And in terms of our healthcare support workers, that actually they'll be able to have a digital aspect of their role because they're the key enablers. And actually, it's our healthcare support worker International Celebration Day. So and all of those are on a career path trajectory, and actually I think that it will help develop further skills in terms of using, again, my medical record. And a good example of that is how they've used it in prostate cancer patients in terms of access. So thank you very much. I think I'm not sure who I'm handing over to next, but I'm sure somebody will say. And thank you to all of the I-team, Aid and Joe and your whole team for successfully launching this day. Thank you.
Thanks, Gail. I believe it's me.
Huh.
So I'm right on to Joe. So just a slide about the environmental benefits, because we all recognise that, just flipped up on the screen there for a second, we all recognise how important that is to large organisations to support the sustainability agenda now. And of course, it seems fairly obvious, I suppose, that digital it can help a great deal in this respect, even if locally it's only a matter of not clogging up the M27 so much every morning and wasting our time doing that. So, but there are many areas where I'm sure you can all think of where digital can support this agenda. So I'd just like to say really thank you for tuning in today. Please share the video with your colleagues. Please do go and read the document. It's deliberately been done in such a way that it's a highly readable and accessible format. So I hope you do enjoy browsing through that. Obviously, if you have any questions, then please direct them at us. We'll be glad to answer any of them.